Right now, it's time for our morning buzz. Now, Brenda is off this morning. Well, today we're talking to Max Richtman. He's the Executive Vice President of the National Committee to Preserve Social Security and Medicare. He's in town because he spoke at the Montana Governor's Conference. And he's here this morning to explain what changes are in store for seniors on Medicare since the health care reform bill passed. So a lot of things going on. Thanks so much for joining us this morning.
Thank you for inviting me.
There's a lot of questions behind everything about the health care reform bill and what's going on with that, when things are starting, how is it going to affect everyday Americans, one of which is Medicare. So what's kind of in store for Medicare patients?
Well, you know, during the debate on health care, it went on for quite a while, as you know, there were a lot of misconceptions put out, myths about what it did, the health care law would do for seniors. In fact, the legislation, now the law, provides a lot of new additional benefits for seniors in terms of preventive care and fewer out-of-pocket costs. It eliminates, the law will eliminate out-of-pocket costs that seniors until now have been forced to make for preventive care. Also, something that most seniors are very aware of, the donut hole, which was created in the 2003 prescription drug law. That is being closed over time and will be eliminated. People now who fall in the donut hole continue to pay full premiums, it's Part D Medicare, and they continue to pay full price. That was unfair. We opposed it. The National Committee to Preserve Social Security and Medicare, our organization, opposed it when it went through the Congress in 2003. We're very happy that it's being eliminated in this new law.
Now, one of the other big things is everyone's questioning is, when does all this take place? Is there anything immediate for Medicare patients that they need to know about with this?
Well, one thing I think Medicare beneficiaries will find very pleasing is this year, anybody who falls in the donut hole, and there are thousands and millions of seniors who will fall in that, will get a check from the U.S. government. The checks are actually starting to be issued in June, and they'll be going out every 6 weeks. And they will be getting a check for $250. Any senior who's in that donut hole, even if they're in $1, will receive a check of $250. Next year, all of the preventive co-payments, out-of-pocket costs, co-payments and deductibles for preventive care that have been applied until now will be eliminated. That begins in 2011. That's some real good news for seniors, and we're very pleased that it's going to be in the new law.
There was also $400 billion in cuts to Medicare. Now, doesn't that kind of contradict what's going on with the whole health reform?
Well, you know, that, Ferdinand, that was part of the mythology that was discussed during the town meetings. I'm sure you heard about them and saw some of them last summer. There are reductions in spending in Medicare, $450 billion over 10 years. These are from providers. These are reductions to hospitals and other health care providers that were agreed to by the providers. Those payments to those providers will continue to grow, but they'll just grow slower.
Okay.
And the important thing to remember is that these savings out of Medicare do not come out of the pockets of Medicare beneficiaries. In fact, Medicare beneficiaries get more and pay less, which is fantastic, and it's a very good deal. And I want to re-emphasize that these reductions were agreed to by the providers in the negotiations with the White House and the House and the Senate.
That's good. Good to hear good news.
Yeah, that's good news.
Yeah.
All right. Well, Max, thank you so much for joining us this morning. And, you know, if you have any more questions, you can give them a call. The number to call is 1-800-966-1935.